Welcome to NCSS Here for You. For over 50 years, Northwestern Counseling and Support Services has been providing access to quality psychosocial services to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. We take our role in the community seriously, and we strive to provide the highest quality services. According to Eric Erickson, a noted developmental psychologist, every person must pass through a series of 8 interrelated stages over the entire life cycle. NCSS provides a continuum of services to meet the needs of individuals who at any point seek assistance. NCSS's purpose is creating a stronger community, one person at a time. Now, let's get to today's show. I'm Joe Halko, Director of Community Relations for Northwestern Counseling and Support Services, and welcome to another episode of NCSS Here for You. Each month in this program, we discuss a human services topic, and we do that with staff from one of our 3 service divisions. Our 3 service divisions are Behavioral Health Services, Children, Youth, and Family Services, and Developmental Services. And, on occasion, we have guests from organizations that NCSS collaborates with throughout the year. This month's episode is titled Applied Behavior Analysis. Applied behavior analysis is the process of systematically applying interventions based upon the principles of learning theory to improve socially significant behaviors to a meaningful degree, and to demonstrate that the interventions employed are responsible for the improvement in behavior. To discuss this subject in greater detail, I'm pleased to introduce this month's guests. And they are Matt Habedank, Program Manager for the Children's Behavioral Health Team, and Ashley Cosgrove, Applied Behavior Services Team Leader. And I'd like to welcome both of you to the show this month.
Thanks, Joe.
So to begin with, what is applied behavior analysis?
Well, actually, I think you did a pretty good job hitting the definition or some of the important aspects of the definition in your intro. Applied behavior analysis is a scientific approach to addressing human behavior and altering human behavior when it's necessary and when it presents a problem or when it needs to be more effective in certain contexts. And ABA really seeks to analyze and evaluate and structure or adapt the environment and changes in environment to help facilitate behavioral change in individuals. So it doesn't focus as much on the behavior itself, although there is a focus on that, but it addresses changing behaviors by changing the environment and the context in which the behavior occurs.
And who can benefit from receiving treatment based on applied behavior analysis?
Well, most of the research supports intensive ABA treatment for children diagnosed with autism spectrum disorder or children with other developmental delays, but it can certainly be applied to other individuals or even adults. A lot of work with ABA through the agency is even applied to children with emotional behavioral disorders, but I would say that really intensive support in ABA is really focused with children with autism spectrum disorder or developmental disabilities.
I think one of the key things about ABA too is that it seeks to only address socially significant behaviors, and what that part of it sort of means is it's not behavior change just for the sake of behavior change. You know, that there might be something that a classroom teacher finds bothersome about a student. One of the challenges of ABA is to sort of look at, is that behavior important? Is addressing that behavior going to bring about a meaningful change for the individual, for their family, to help them access the, in this case, an education environment, in that case, better. So really that's a key part of the evaluation and sort of evaluating who ABA would be effective for is the behavior itself, and is the behavior meaningful? And that's one of the ethical responsibilities of a behavior analyst is to make that determination early on in the process and only engage with behaviors that are meaningful in that context.
And I know we touched a little bit on this, but what types of behaviors can applied behavior analysis address?
Yeah, so kind of off what Matt said, not only do they have to be socially significant behaviors, they have to be overt behaviors, so behaviors that are measurable and observable. ABA relies heavily on data collection to evaluate treatment procedures. So ABA is very effective to build skills. So if an individual has certain skill deficits, maybe in communication, language, social skills, life skills, ABA can help to use teaching procedures and prompting procedures to increase some of those behaviors. ABA can also be effective for decreasing maladaptive or non-desired behaviors such as aggression, non-compliance, things along those lines.
One of the interesting things about ABA too is that there's a really large research base. So the scientific nature of the discipline demands that practitioners evaluate procedures. And one of the tenets of applied behavior analysis is to determine not just that there was behavioral change and not that there was change just to a meaningful degree that it can be measured and it actually made an impact on the individual's life, but that you're determining that the procedures that you employ are actually what is responsible for the behavior change. So it wasn't due to random chance, it wasn't due to a factor outside of the immediate environment that caused the change, it wasn't due to the cycle of the moon or something like that. It was what you did and procedures that were put in place that actually brought about the behavior change. So going along with that, there's a lot of research, that goes into ABA. And if you look through the research base, which is pretty extensive at this point and dates back, in ABA formally into the late 60s, there's a lot on habit reduction that ABA helps address, organizational behavior management, so safety in the workplace, compliance with employee expectations, behavior in the workplace. A new area is behavioral geriatrics, addressing sort of work with the aging population, which is not anything that we do directly at NCSS, but it is all part of the scope of what ABA helps to address. Really any behavior that's meaningful and important that you would want to increase or decrease and has a real profound effect on the individual's life is that something that ABA might be able to play a role in.
So Matt, you had mentioned that the research goes back as far as the late 60s, so we're talking about almost 50 years, which is a significant time frame. Is it not also true that ABA is taking a much stronger foothold today in being able to help individuals, or am I wrong there?
No, absolutely. I think part of the reason that ABA has become a little more visual, or a little more visible and a little more predominant as in terms of a treatment modality today is the more common occurrence of autism as a diagnosis. ABA is effective for a lot of things and a lot of different behaviors, but is shown in general to be very effective in ameliorating some of the difficulties associated with autism. So while there is a big research base dealing with other behaviors and students with emotional behavior disorders and a whole range of stuff, the commonality of autism as a diagnosis has really brought ABA much more into the forefront.
I see. And what kinds of ABA services are offered at NCSS?
Well, there's a number of different ones. Ashley is helping to head up and start a new program called the Applied Behavior Services Team, where ABA services are going to be offered to kids 18 months through 21 years, depending on the individual circumstances of the child, in home and community settings. And I think that will look like some work in the center, in the family center at 130 Fisher Pond Road, and in an environment there. Can look like work in the homes of children and their families. Can look like outings into the community and work done in the community. And that's a great option to be able to offer at NCSS. There's a number of other ones I'll get into a second, but that really sort of completes a continuum of services through the birth to 21 age, both in the home and community and school, that was one of the last big pieces in the puzzle that we've been able to sort of implement now, and the agency are getting ready to start with, which is really, really exciting, and I'm happy that this is something that's finally going to be offered to the families of Franklin and Grand Isle counties. In addition to that, there's the school-based autism team, which is really a ABA treatment model. They work both with children with autism as well as other individuals with a whole variety of diagnoses. I think that's one that, in a few months they may be on the show to talk about specifically what it is they do. because they do work with a whole variety of children with different needs in addition to the children on the autism spectrum as well. So that they're in local schools all over Franklin and Grand Isle counties, and that program is usually contracted by the school system and by people within the school system who identify a child with a need in the schools. SOAR Learning Center has an ABA component both in the school in general as well as the back to school program that utilize ABA as well as a number of other different modalities to address the behaviors of the children and the needs of the children and families that work with SOAR. The Collaborative Achievement Team, the CAT team, also works with children in local schools in Franklin and Grand Isle counties, and they use ABA as a strong part of their treatment package as well, along with a few other modalities as well for the CAT program, and working largely with kids with emotional behavior disorders, that kind of thing. You know, kids who need some behavior support within the school and to address some behaviors within the school setting, not necessarily on the autism spectrum. So that's sort of the different side to ABA, if you will, the same set of modalities and interventions applied to a different population in a little bit of a different way. Am I missing any? I don't think so.
But you're right. It's a really nice component because we can really take what some of the school programs are doing and help carry over some of those supports into the home for children to help them generalize some of those skills they're learning.
So without a doubt, very broad base as far as the number of programs whereby ABA can be utilized to assist.
Absolutely. Yeah, I think there are certainly, like Matt was saying, some more intensive supports with the younger children. I mean, research supports those kids getting about 25 hours a week of intensive ABA support. So we have everything from that, like Matt was saying, to just small components of ABA and some of the other school-based programs.
And I think the thing about ABA too that makes it interesting and really does make it applicable to a wide range of populations and in a lot of different areas is because it's a very flexible approach. There are a set of procedures and interventions and protocols associated with it, but they can be applied to specific kids or adults, whoever, in specific ways and really tailored to meet the needs of the individual. It's one of the things that makes it a really unique treatment approach in that sense.
And speaking of that, what are some of the key elements to an ABA program?
Well, certainly assessment is a key component. Typically when we get referrals for ABA services for children, we would start with assessment. So some of those assessments we may conduct would be a functional behavior assessment, and really what we're doing with that is we're looking at behavior and the function that it may serve and how can we replace that to something that's more socially appropriate. So that there's a whole process of doing the functional assessment. There's also some assessments around skill building so that we can see where a child's strengths may lie as well as what we need to increase using ABA procedures for teaching. So once the assessments are complete, that really goes into writing a treatment plan. So that might be a behavior plan based on the functional analysis we did where we're really hypothesizing why that behavior is occurring and coming up with an intervention to decrease some of those maladaptive behaviors we see. We will also come up with some teaching procedures and curriculum around skill building. The interventionist will work to record a lot of data to make sure that we're increasing what we want to see increase for those target behaviors and decreasing the maladaptive behaviors. So it's really data driven. And that really aids to our treatment planning. If it's not working out, we'll go back and rework the plan or go back to the functional assessment. And then from that, we do a lot of generalization of skills. I think it's a goal to always have children be as independent as possible. So as our interventions are working, we really want to fade those interventions when appropriate and generalize those skills across environments. So if the child is receiving services in a school-based program, it'd be very important to then carry that over into the community, into the home settings.
So a real wraparound approach as opposed to...
Yep.
And one of the things that Ashley said I just want to hit on a little bit more is the data collection. That's one of the things that makes ABA a scientific approach to behavior is the constant collection of data as it applies to the behaviors that are defined in and of the beginning. In ABA, it's important to sit down and say this is the behavior that we want to address. This is what it's going to look like in a very specific sense, and then measure it constantly to see what's happening with it. And it's the measurement of that data that really guides your interventions to say, are we getting the effect on the behavior that we're looking for if we're trying to increase verbal behavior from a young child, are verbalizations really increasing? And if they're not, then we need to look at the intervention that we're employing and change it a little bit and see if we have everything exactly right to really get the most benefit of the treatment package. That's an important one. The other one is the function of behavior. Is really spending time identifying the function of behavior. So the idea that all behavior is purposeful, which some of my former instructors will appreciate hearing me say that on camera. The behavior happens for a reason. So whatever behavior an individual is engaging in, they're getting something out of it. They're getting access to something. They're avoiding something. So addressing behavior through examining its function, what the individual is getting out of it, not so much what it might look like in a moment, but what the function is that's associated with it, and what tends to happen right before and right after. Those are all really key components, and something that elements to an ABA program, that's what they would seek to take a look at to help drive their treatment planning and behavior change. I think the other thing that's key, it's not just for ABA programs, but it's an important aspect of them as well, is family involvement and a lot of communication with the family, a lot of talking with the family to see what behaviors are important for them, for the child, to get their buy-in and to get their commitment to working, because some of this treatment is not easy work. It's certainly very difficult for the kids at times and very difficult for the families, depending on what exactly is going on. So their commitment and buy-in and feedback and constant input and communication is really vital to long-term success for the kids that we work with. And without that kind of communication and dialogue and feedback all the time, we wouldn't be able to be successful, certainly. And I think that's overarching across work in the human services field and the work that we do at NCSS as well. I don't think that's unique to ABA programming, but it is definitely an important element that facilitates a lot of success.
And speaking of the families, what does providing ABA services to a child and their family look like? And one of the things I also want to ask is that I think, Matt, you had touched on, is the fact that even though this is data driven, it still is very individual and unique to the individual, and not like a cookie cutter type of scenario.
I think it really depends on the needs of the client and the needs of the family. I mean, it can look like anything from a child with a brand new diagnosis, maybe at 2 years old, coming in, like Matt said, to receive some intensive supports and then carrying over some of those interventions into the home. But it could also look like carrying over what the school's already doing and helping them generalize some of those skills. Or we can even do more of a consultative model for parents that maybe need help around a bedtime routine for their child and some reinforcement procedures that may help with that scenario. It could even look like bringing kids into the community that have trouble sitting in a dental chair or getting a haircut and coming up with a procedure to really target that. So it's really individualized, as you were saying, and it's nice because we're able to meet the needs of the family in all different settings using the principles of applied behavioral analysis.
And like Ashley said, I think a lot of it's about meeting families where they're at. Even I think Ashley mentioned earlier about the young children, the research sort of dictating that 25 hours a week of direct ABA instruction is an ideal amount to really help build skills for a young child with autism. For some families, that may or may not be possible. You have to really meet them where they're at as far as hours of service, where the service might take place, whether it's in the center, whether it's a home, whether it's in the community. And that's part of that constant communication, I think, is trying to get a sense of, when we start working with the family, where they're at, where their child is at, and how they really want to move through that. And giving a lot of feedback and input ourselves on what we think is the ideal course of treatment and hours of treatment and things like that, but really trying to understand where they are with that as well. Because again, without family buy-in and family support, those behaviors will have a hard time, even if we can facilitate behavior change in a certain setting, helping the child be more independent at home, operate in the home environment, and see those things without a therapist present, without a worker present, just in that child's interactions with whoever it is from day to day. That family buy-in and sort of meeting them where they're at is really, really key.
Is there any sort of a minimum? I mean, I know again that every situation is unique and different, but from the research and from what you've been able to experience, is there sort of like a minimum that one must get involved with to ensure that this is going to be successful as far as a treatment model, or is there no such thing as you must have a minimum of X amount of hours or what have you per week?
It really depends on the individual. I think certainly for early intervention, research is very strong in saying that children, to have the maximum effects of ABA, really need around 25 hours a week of very intensive support. But that doesn't mean 2 hours is not going to help them. I think any form of ABA will be helpful. I think just to maximize results and really get children ready for school, research supports 25 hours for early intervention. But I mean, ABA might be very applicable for a school-age child that just needs help with a certain routine after school, and maybe 4 hours a week is substantial for that family. So it is really individualized in that sense.
I think a key part of that is that they need to have an opportunity to practice the behavior that we're looking for them to engage in, and do it often. You know, practice it for a while to sort of build it up in their behavior repertoire and make it just what they do, you know, as part of their day-to-day behavior. So whether that's decreasing something like tantruming or a behavior that you'd like to see decrease, and then the corresponding increase in communication or a coping skill, taking a time out or a walk or a break or something like that. They need to practice that, and they need to practice not engaging in perhaps a maladaptive behavior or a behavior that's causing problems, and engaging something that's a little bit more socially functional and is going to impede them less in their, you know, their behavior and their operations within their environment. So sometimes, if you take like a school child, for example, you know, who maybe doesn't get ABA supports through the school day, and you want to address something in the home environment. For a kid in 4th grade, you're not going to be able to do 25 hours of service a week after school. And in that sense, again, we go back to family buy-in, you know, where we as practitioners will be able to be there for a certain amount of time. So some of it becomes helping train the families in implementing these interventions themselves, and helping them help the child practice the techniques and reinforcing the behavior when it happens. So that becomes a key element of that as well. You know, sort of meeting where the family, where they're at, figuring out what you can do. And, you know, the more family buy-in you have, and the more the family can facilitate some of that, which is, I think, where you head anyway, is the people who are with that child in their natural environment, without a sort of being an artificial addition to that. That's where you're heading anyway. So the more we can do that, the better, certainly. And sometimes, you know, the more you can do that, the less hours of service you have to provide. And I think the flip side of that is also true.
So yeah, how can we help train teachers or parents to be the interventionist, and give them those tools to help carry out those interventions through all settings is like Matt was saying, is really ideal.
And speaking of training, Ashley, what kind of training do staff that provide ABA services do they have or do they receive?
Well, all ABA services should be overseen by a board-certified behavior analyst, which is a master's level, and then you take a certification exam to make sure that all ethical and behavioral principles are being followed consistently. Staff providing the interventions need significant hours of training in ABA techniques and ethics, and all of the plans are overseen by a board-certified behavior analyst.
So it can be extensive. The board certified behavior analyst certification is 1,500 supervision hours by another behavior analyst that's currently certified, and coursework, and, you know, a lot of implementing the procedures. So not just theoretical knowledge of ABA, but actually going in, implementing it, practicing it, making sure that all the ethical guidelines are held to, and not just that you're implementing the techniques appropriately, but that they're being targeted to the appropriate behavior in the right situation, in a way that's most beneficial for the kid. So that takes a lot of training and a lot of supervision, and then, you know, like Ashley mentioned, for the staff that are sometimes providing the direct service as overseen by a behavior analyst. A lot of supervision, not just in an initial, you know, upfront, you know, training before you start the job, but a lot of ongoing supervision and discussion and review of the techniques, and sort of the I do, we do, you do model, you know, where the behavior analyst would show them how to implement a technique, do it together, practice, give feedback, and then observe them doing it. And then again, on an ongoing basis as well as upfront.
Now, how do families connect with these services at NCSS?
Well, in general, they can call Samantha Thomas, and I made sure it was okay to give everybody her phone number. Samantha's number is 393-6584, and she is the team leader of our children's initial response team, and the intake team. So really, Sam is one of her functions, and that she's fantastic at, is hearing what's going on with the child, with the family, and trying to direct them, where they're going to get the best service. For some people that would be the ABS team. For some people that would be another team and another program within NCSS. No, but Collins, Samantha is definitely the way to go. School services tend to be accessed in a little bit different way. That tends to be on a referral from the IEP team, or the school attempts to contract for the services when that becomes an identified need in the school. But for parents, calling Sam is definitely the way to go at 393-6584.
Okay. Now, are there any success stories that you could share that were, it's very definitive here locally that this treatment model has significantly made a difference in someone's life? I mean, something that is generic in nature that you could share. Does anything come to mind, or?
I mean, for me, just working with children with autism that come to you with no language, no means to communicate. I mean, some kids are even in middle school age at that point. So just really doing some intensive verbal behavior work with them and teaching them to sign or use vocals appropriately to now where they're able to approach someone and ask a request for items. I think that's always so interesting to see, and definitely a success. I mean, when you can give children a voice and a means to communicate, it's certainly a success story.
And I can, as a parent myself, and having worked with a lot of families and children, that are sort of in the situation Ashley described, that's having that ability to communicate, with your child and be able to have a conversation and exchange, those kind of communicative ideas is, I don't think you can, you measure the impact that can have and how meaningful that is to families and children both. And for the kids, it's really a whole new way of interacting with their environment and getting their needs met, and experiencing the world around them is opened up. And again, it's amazing to watch a child go through that, for sure.
When you mentioned that individuals on the autism spectrum and with other developmental delays are among those that can benefit the most from this, and I know with the continuing increase of those diagnosed with autism, it seems like every year that number continues to shrink, that only means that this particular treatment modality is going to be necessary in far greater numbers as the years would progress, I would imagine.
I think especially with early intervention, I think it's key to start doing some of this intensive ABA support when kids get a new diagnosis, and you can fade some of those interventions and give them means to communicate before they're school age, so that maybe they can be in a more inclusive setting and be more independent as they go through life.
I think some funding is helping to access some of this as well. It's the question of how the services get paid for, I think, is always on people's minds. A couple of years ago, Vermont passed a law to fund ABA services through private insurers, and I think that's helping to open the door for a lot of families who otherwise might have struggled to have access to treatment to get quality services for their kids. So I think that's another a recognition of the value of ABA and its contribution in the spectrum of treatments available to kids, but as well as just a statement of how much more you're going to see it, I think, in the public eye, and run into people who have accessed it, whose families have had a ABA-based treatment program and seen some real benefits from it.
Well, it's hard to believe, but our time is up, and this has certainly been a very fascinating discussion. I want to thank my guests, Matt Habedank and Ashley Cosgrove, for being on the show today and sharing their insights on applied behavior analysis. I also want to thank you, the viewer, for spending time with us again this month. You can learn more about NCSS and all of our programs and services by logging on to ncssinc.org. I'm Joe Halko, and I'll be back next month with another episode of NCSS Here for You. This has been another episode of NCSS Here for You. We hope that you found today's discussion informative and educational. For over 50 years, Northwestern Counseling and Support Services has been providing access to quality psychosocial services to the residents of Franklin and Grand Isle counties. Over the years, as the needs of the community have changed, so too have the programs and services that we make available to assist children, adolescents, adults, families, and seniors. Thanks once again for tuning in this month. NCSS's purpose remains creating a stronger community, one person at a time.